Bismillahirrahmanirrahim. Alhamdulillah, sallallahu alaihi wasallam ala Rasulillah. It's my pleasure today to be here in this prestigious conference, and I hope you will enjoy our show, inshallah. Okay, you may wonder why.
يا جماعة لو سمحتوا الصوت عالي، الصوت عالي يا جماعة لو سمحتوا. كلنا جعانين، أنا أول واحد جعان، لو سمحتوا.
You may wonder why I put this photo in the first slide. And I just want to emphasize a concept, which is the meaning of life is not just about money, even in the poor economic circumstances that we are living nowadays. For example, if you get insomnia, won't you pay hundreds or even thousands of dollars to be able to sleep? You can keep the answer. Our authors are Dr. Elhout, Elhout, Hiba Baraka, Isra Khadir, Huda Abu Nimr, and Isra Awal. And our supervisors are Dr. Bettina Butcher and Dr. Khamis Alissi. Our outline will be introduction, objective, methods, results, conclusions, recommendations, limitations, and acknowledgements. Although several previous studies have examined the medical and clinical consequences of breast cancer, this is the first study to examine the physical and psychological impact of mastectomy in breast cancer female patients in the Gaza-Strip. Our objective is to identify these various impacts of mastectomy on the physical and psychological well-being among these breast cancer survivors in the Gaza-Strip. This was a cross-sectional study, included 173 female patients, conducted at Ashifa Hospital, Arantisi Hospital, and the Arabian Gaza Hospital from August 2015 to 2016. Our inclusion criteria was being a female, the age should be between 25 to 75 years, being married, oriented, coherent, and able to give a consent. In addition, our patients should have their mastectomies before at least 6 months before filling the data collection sheet. These mastectomies should be performed either at the Ashifa Hospital or the Gaza Hospital. Our questionnaire was a self-designed questionnaire that was filled during an interview, and we used a 5-point Likert scale to measure the variables. This questionnaire was reviewed by 15 experts in this field. In addition, it included 3 main sections: the socio-demographic data, the physical well-being, and the psychological well-being. The data analysis was done using the SPSS software. Regarding our results, when we looked at the age groups, we had 3 main groups. 32.9% had an age of 46 or less, 34.7% were between 47 to 56, and 32.4% were 57 or more. When we calculated the body mass index of our patients, we found that only 14.5% had a normal BMI, while 32.9% were overweight, and the majority, 52.6%, were obese. With regard to the treatment our patients had, only 3.5% had surgery only, 2.3% had surgery plus radiotherapy, and 38.2% had surgery plus chemotherapy, and the vast majority, with 56.1%, had a combination of surgery plus radiochemotherapy. With regard to the type of surgery our patients had, only 16.8% had breast conserving surgeries, while the rest had amplified radical mastectomy. The surgery was done before 6 months to 1 year before filling the data collection sheet in 43.4%, and before 1 to 4 years in 25.4%, and before more than 4 years in 31.2%. When we asked our patients about the impact of mastectomy on their physical well-being, we had 3 main answers. fatigue was coming in the first position with 57.3%. This is followed by some menopausal symptoms in 48.6% and a loss of appetite in 32.2%. In addition, 26.6% had menstrual disturbances and 20.8% had sleep disturbances. In addition, weight gain was observed in 18.5% and weight loss was observed in 15.6%. We also asked our patients about the impact of mastectomy and their psychological well-being after 5 stations throughout their journey for treatment. And we surprisingly found that the impact was most significant just after the chemotherapy. And it was also surprising to find that the impact of mastectomy was less significant than their condition just after the diagnosis. Among patients who received radiotherapy, we found that 19.7% had an impact on their psychological well-being, and among those who had hormonal therapy, we found 15.6% to be impacted. Our conclusions are the overall physical well-being. The overall physical well-being among breast cancer patients after mastectomy was decreased with many different complaints. The impact of breast cancer on women's psychological well-being is stronger after the diagnosis of breast cancer rather than the mastectomy itself, and this is probably due to their natural adaptation to their conditions. And lastly, the rate of breast-conserving surgeries is extremely low. Our recommendations are to hold workshops for families of mastectomized patients to show the significance of family support to their psychological well-being, and establish a visiting program to psychiatric clinics in Gaza community mental health program for these patients. And finally, further research to look for causes of this low rate of breast-conserving surgeries should be conducted as soon as possible. And by the way, the IUG Medical School is now conducting a research on that, and everyone here is welcome to participate. Our main limitation was the crowdedness of the oncology clinics, and so securing privacy was a very hard job to achieve. Finally, I would like, on behalf of my team, to thank these great surgeons and doctors for their support and for reviewing the data collection sheet. Dr. Subhi Skeik, Dr. Riha Abid, Dr. Bassam Mohammed, Dr. Isama Abdullah, Dr. Ala Abu Sabah, Dr. Khalid Thabit, Dr. Ahmed Shroqa, Dr. Taysir Diab, Dr. Aisha Noor, Dr. Yusuf Al-Jesh, Dr. Sana Abu Bakr, Dr. Anwar Abadsa, Dr. Atif Al-Agha, Dr. Mahmoud Abdullah, Dr. Samir Buta. Thank you.
شكرا دكتور محمد.